Appreciate you taking time out of your busy day. For many of you, this might be just some review and reinforcement. Hopefully there might be some new tidbit for some of you. So again, we're talking about women's health across the lifespan, through the ages. And I think it's kind of interesting when you get a group of women together and you ask them, what's your greatest health concern? Still, the vast majority of women say breast cancer. That's the, my biggest health problem, breast cancer, cancer in general. And I took this information it was from an article in 2000, and I found another one that was done in like 2004 or 2005, and it was still very, very similar. We perceive breast cancer, other cancers as our greatest health concern. A lot of people just didn't know it all. About 7% of the people said cardiovascular disease. Interestingly enough, our real health concerns, it is heart disease is number one. Other cerebrovascular diseases, stroke, things like that, that's another problem for us. Actually, cancer in general only accounts for about 23% of all causes of death, and breast cancer, wonderfully, that's the good news, only about 3% of causes of death. Diabetes, another 3%. Chronic respiratory problems, about 5%. So those are our big health concerns for women overall and all causes of death. As far as health concerns of women at various ages, top health concerns for young women, of course, reproductive health issues is a big one. Menstruation, PMS, contraception, fertility, infertility, pregnancy-related issues, childbirth, sexually transmitted infections. So all those reproductive categories is the biggest area. Mental health concerns, also an issue for women in younger ages, such as anxiety, depression, eating disorders, substance abuse. And in young women, we start to see some of the problems with autoimmune diseases, things like rheumatoid arthritis, lupus, multiple sclerosis, type 1 diabetes. As far as what kind of health screenings do we need to protect and promote our health as young women, to promote heart health, they recommend that you have your blood pressure checked every 2 years, and if it's normal, you don't need to do it any more frequently than that. Have a cholesterol, a lipid panel done at age 20. Again, if it's normal, every 5 years is sufficient, unless you have an abnormal reading or family history. As far as breast health, young women need a clinical breast exam every year. Self-breast exam is something that we have touted for years and years and years, and the American Cancer Society and other breast health specialty organizations have backed off on that as a monthly recommendation now. Their take is that if you practice breast self-exam, continue to do it, that's wonderful. Again, point out any abnormality to your healthcare provider. If you don't practice it, don't feel guilty about it anymore, as long as you are seeing your healthcare provider once a year for a clinical breast exam, and incidentally, if you notice something abnormally, report it. Typically, women in this younger age group don't need mammograms. We recommend that now that you start at age 40 and have one every year. And a lot of women say, well, why can't I have a mammogram? Why can't I have one? And at 28, I'm concerned about breast cancer. And part of it is it's hard to get a good quality mammogram. When you're younger, your breast tissue is denser, you have more hormonal influence, more estrogen, higher estrogen levels, so your mammogram is very difficult to read. It just looks white. Where the older you get, a little less hormonal influence, the mammograms are easier to read, to find abnormalities, and your incidence of breast cancer goes up. The actual incidence in a young woman is very, very low, thankfully. Since reproductive health issues were a big focus for women in those younger years, screening tests that we recommend are a pap smear, either beginning when you're sexually active or by age 21, and then repeated every 1 to 3 years. There is evidence to say that if you've had 3 negative pap smears in a row, you can go to less frequent screenings if you are low risk. And by low risk, they would mean either one monogamous sexual partner or not sexually active. They do recommend that young women be tested for chlamydia with every pap smear as well. They say up to age 25, routinely, and for older women if they are at increased risk. Other screening exams, health issues to pay attention to that we might not think about is a skin exam. And the rates for skin cancer have steadily increased over the last decade and continue to increase at kind of an alarming rate. So it's very important for you yourself to check your skin for abnormal, any moles or lesions you're concerned about, and certainly have your healthcare provider do it as part of your routine exam. Dental health, frequently overlooked, but actually dental problems can contribute to a lot of other health problems as well. So it's important to have those exams, a dental exam and cleaning once or twice a year. Immunizations, not just for babies. We're all very cognizant of the immunizations that babies need, but we as adults need them as well. Tetanus shot every 10 years. I'm guessing that a vast majority of people in here will know when their last tetanus shot was, because if you worked here, it was probably June of '08. And I thought, we'll always remember that if you got one last year. So you'll know in 10 years. The hepatitis B vaccine, it's a series of 3 shots. Hepatitis B is a serious blood-borne infection. Again, if you're Mercy employees, you can have that here free of charge, and it is a good series to protect you. The human papillomavirus, HPV, it is a virus that's sexually transmitted, and it is linked to cervical cancer. So there is a vaccine now available. Actually, there's 2. Gardasil is the more commonly used one, and it also is a series of 3 shots that is recommended for all women under age 26. And there's some, like the pediatric groups would like you to start doing it at age 12. I think that's a family decision, but clearly before a young woman becomes sexually active, the Gardasil is a good vaccine series. There have been some reports in the news about some adverse effects which are concerning to parents, and certainly discuss that with your doctor if you're a parent immunizing a child, or if you're a woman over 18 making your own decision, find out the risks. But typically the risks the benefits greatly outweigh the risk. I've had people ask me, well, what about women, why not women over 26? And actually, it's at this point not recommended because they feel the majority of women by age 26 have probably been exposed to the virus through sexual activity. If you don't fall into that category and you become sexually active after age 26, you can talk to your doctor about having that vaccination. A second dose of that measles, mumps, rubella vaccine usually falls into this age category, and for women on the younger end, 18, or men actually, the meningococcal vaccine is strongly recommended. Anyone who's going to be living in a communal environment. So whether you're going off to the military and will be in the barracks, or going off to college and will be in a dorm room, that vaccine is very important. And we have had some deaths from meningitis in our community, so I do have a heightened awareness for that. Now, women in the middle years. Health concerns for women over 40. Heart disease, breast cancer, osteoporosis, depression, and diet and nutrition are really our top health issues. As far as screening exams that are important, again, blood pressure every 2 years, and more frequently, if it's abnormal, a cholesterol test at least every 5 years. I did put there's some pamphlets in the back about that describe the Heart-to-Heart program, which is a program that we offer here at Mercy, a reduced rate for employees, and it's also a screening program open to people in the community. Good way to learn a little bit more about your heart disease risk. That Heart-to-Heart program involves a complete lipid panel, blood sugar, having your blood pressure taken, height, weight, calculate your BMI, heart and lung assessment. You fill out a questionnaire that asks a lot of lifestyle questions, and then meet with our exercise specialist to put all the information together and get a personalized view of your particular risk and a personalized plan to reduce your risk. So if you haven't done that, do consider that. The Heart-to-Heart is a great program. Again, skin screening is very important in this age group as well. So check for moles, have your physician check during your exam. Again, the dental health cleaning, very important. Now at this age, there's some other screening tests that are important for you as well that kind of come into play. Diabetes is a problem. The incidence rates are increasing, almost exponentially in society. So we do recommend that people be screened with a fasting blood sugar every 3 years, starting at age 45. And luckily that's fairly easy to accomplish. Thyroid testing is also something that is recommended, that you have your thyroid levels checked every 5 years. And thyroid problems are much more common in women, so it's really definitely promoted for women in this age range. And oftentimes low thyroid is very subtle and accounts for some of the symptoms that we might experience in this age range. Again, very subtle, very mild at first for many people. Fatigue, weight gain, intolerance to cold, thinning hair, menstrual cycle irregularities, all those are kind of vague symptoms that sometimes start cropping up in women this age. So it is a good idea to have your thyroid checked, because that's something that's fairly easy to rule in or rule out. Immunizations in this age range, it's just the tetanus shot every 10 years. Once women get over 50, many things are the same. Again, the blood pressure, cholesterol, your annual mammogram. The things that are new for women over 50 are that colonoscopy. And we have a couple of our digestive health center nurses here that will take very good care of you if you are in that age range and need the colonoscopy. It's just a great screening test. It's actually truly a cancer preventive exam. If you have a polyp, they can remove that, and it may or may not have advanced to cancer, but you've had it removed during your colonoscopy. The good news is if your colonoscopy is negative, you only have to do it once every 10 years. So it's, very, very important. So if you are 50 or over, have a family member, strongly encourage them to get that colonoscopy.
Does that include if you have a benign polyp?
That every 10 years. It's still every 10. If they found adenoma, it's every 3 to 5, I think. Every 5.
Well, they've changed it. It used to be every 5.
If it's an adenoma, they would want it done every 5.
Every 5.
Mm-hmm. See how we've got our experts right here. Reproductive health, still the pap smear frequency based on your risk. Again, skin health, very, very important. You start having more benign skin lesions, so sometimes it's hard to discriminate. So do check yourself for skin changes. Do have your health care provider look at that. Dental health, again, very important. I don't think it is. Blood sugar again every 3 years, thyroid test every 5 years, the frequency of low thyroid increases greatly after 60 even. Immunizations, again, the tetanus every 10 years, flu vaccine every year. The two things that are new in this age range are once you're over 65 to have that Pneumovax, the pneumonia vaccine. And for most people, healthy older adults, that's a one-time